I've been asked to share this update about the International Health Regulations, the WHO, which is going to be ratified on the 19th of July. So, depending on when you're watching this, will determine how many days that are left. I was specifically asked to look at this specific Substack, for which the link is in the description, talking about rejecting the 2024 International Health Regulation amendments by the WHO. And they are very strongly advocating that world leaders, so you can take a look at the letter that they have asked to be shared to leaders in different parts of the world about rejecting the amendments. And essentially, what I'll quickly go through are the points that they are raising with regards to their concern about what is happening and why they think that this is such a serious issue. My personal perspective is that I think that the WHO did not handle the origins very well. They hadn't investigated it then, and they haven't investigated it now. And so the combination of those factors are likely to be contributory to where we are today. Additionally, when we look at what has happened in terms of the ongoing circulation of virus, I think step up, not necessarily get more powers, which is what they're advocating for. This is the challenge that we're facing today. So here is the amendment, so to speak, the top 10 reasons why they're trying to reject these amendments. And one of them, in number two, is that the Director General of the WHO would be empowered to declare a pandemic emergency based solely on his determination with no checks or balances. And so, yes, you can see that that in itself, in an environment that has become politicized, meaning that there's a lot of politics involved, decisions are not always just based on the health of the population. In that kind of scenario, one of the concerns that has been raised is that you can therefore declare climate change a health emergency, and so therefore force through changes in countries across the world that may not necessarily be within the remit of control or by the different political parties that people had voted for. So these are big concerns and not easy ones to address. It's important to note that we do require some cooperation and collaboration between countries across the world, as we saw with regards to the pandemic. But my view is that the checks and balances haven't yet been done, and we haven't had a good assessment as to what decisions were made and whether or not these were actually in the interest of the populations. So they had pointed out in three, there's an aim to increase domestic funding, but how much is that depending on the countries that are involved? Um, they are looking at in number four, the Article 44B1S was added to the IHR in a constitution in February 2023, looking at financing, explicit financing function under the WHO regulations. They highlighted that there was failure to properly submit a final version of the proposed amendments. This here in number six stood out to me. This is why I've highlighted it, which is absolutely unacceptable that healthy people who are merely suspected of having been exposed to a contagious disease may be quarantined. Again, this is tying into what happened in the context of the pandemic, where we had a degree of mandates that were instituted. Arguably, depending on where you're talking from, these were unconstitutional. They violated people's rights. And in the end, they needed everything to work perfectly, which it didn't. We are now in a situation where we have ongoing high circulation of new variants of viruses. It seems that population immunity may have been damaged. We have big questions to answer. And to think that people who instituted that in the first place have had no consequences for that and are actually getting more power, in my view, is not acceptable. And so when we think about this, it's not so much the details, because we do have the situation where if you had a very serious virus that was spreading, say the Nipah virus, where you needed urgent collaboration, didn't have time, there may be some indication for doing some of these things in terms of quarantine if somebody was obviously infected. However, in an environment where there have been failure of checks and balances, having this kind of system in place, I think is dangerous. And so, on balance, and I've shown you the link for you to be able to look at, you can read it for yourself and make your own mind up. This is by James Roguski, and he goes in detail explaining all of the points that he says. You only have a few days, because that's about 6 days from now. And it's difficult to know if anything can be changed or what are the points that need to be raised to different governmental bodies in order to protect the integrity of the population. So, as I said, I am just giving you this update, which had been shared with me today. I wasn't aware of the timeline, and I thought that I wanted to keep you updated with regards to what was going on so that you have a chance to reflect on what is happening. And if you have the ability to raise your voice, then please consider doing so. Have a great evening.